Well, just hours ago, a joint oversight committee of the North Carolina General Assembly heard from one of the state's agency leaders about some of the biggest challenges facing childcare.
And that includes costs for families, the number of licensed facilities, and retention of employees. WCNC Charlotte's Autumn Bracey joins us live in the studio with more on what was discussed and how leaders are seeking solutions to address those issues.
Siobhan and Jane, in the meeting, North Carolina's director of the Division of Child Development and Early Education described what she calls a growing crisis in the state's child care system.
Yes, a lot of the daycares we've been touring and trying to get into, there's wait lists of 6 to 7 months.
Right now, state agencies are looking at how to improve access for families and strengthening benefits for providers in the daycare industry. Candace Witherspoon with the Division of Child Development and Early Education says a governor's task force is working to address those issues through a series of new recommendations. Those ideas include exploring the creation of a child care endowment to help fund long-term child care needs and looking at partnerships with the University of North Carolina system and K-12 public schools to expand child care access for public employees and students.
So I'm getting messages every day from parents looking for child care in the area. The full-time facilities tend to be full with long wait lists, and then they reach out to me.
Heather Eford tells me Matthew Presbyterian Church Child Development Center offers a half-day preschool program for children. Even so, she says the facility stays busy, noting options remain limited across the board.
We are full, and moving into the new school year, we have wait lists on almost every single one of our classes.
The Division of Child Development and Early Education says improving availability is critical. Officials estimate if the number of child care facilities doesn't increase by 2027, North Carolina could drop below 5,000 licensed facilities, a record low. Eford tells me limited availability has continued to worsen since the pandemic. She adds the high cost of operating these centers is also a major challenge.
We have to cover all of the classroom consumables, classroom improvements. You have insurance pay, you're paying for your staff. There's a lot that goes into the price of childcare, not just paying for your teachers.
At the heart of this crisis are families, many of them struggling to find care, especially in rural areas where the biggest declines in licensed child care facilities are happening.
It's hoping for the best. We're hoping the spot opens up, doing our research, being open to maybe not our first option, being open to the second, third option, and going from there.
And NCDHS says it's working to create more pathways for people to earn a child care license while also exploring additional ways early childhood educators can meet certification requirements beyond a traditional degree. Siobhan, Jane.
All right, trying to come up with some creative solutions at least. Thanks, Autumn.